Hey everybody. My name is Lindsay Berra. I'm the head of content at Mustard, and I'm very excited about this call tonight. We have Dr. Jeff Dugas, who is the fellowship director of the American Sports Medicine Institute, founding and managing partner of Andrews Sports Medicine Orthopedic Center, both of those in Birmingham. Jeff is the guy who fixes all the arms, big league arms, little league arms, and all the arms in between for many, many years, which is impossible because he's only 26. Um,
May have to fix your arm.
yeah, right. You may have to fix my arm. I might be on a plane to Birmingham pretty soon. I thought about it. Don't think I didn't.
I know.
Um, so I'm going to start with just a big overarching question. How has the landscape of arm injuries in baseball changed since you played and over the years that you've been a doctor?
Well, first, thanks for having me as always. And it's great to see you and spend a little time with you. So thank
Yeah.
you. The landscape's changed a lot. When I first started with Dr. Andrews back in 99, these were injuries that we saw in, high level college and pro guys. Now we're seeing them in middle school kids. The rate of these injuries and the causes of them is really just the whole thing's just exploded. It hasn't changed. It hasn't gone in the right direction. In spite of the common knowledge that we have about what not to do, it seems that things are getting worse. So I think it's definitely gotten worse.
Is I mean, you're seeing more and more players coming in. You're becoming busier and busier. Is there a common thread amongst all the guys that you see whose arms you have to fix?
At the not pro level, yes. At the pro level, they have so much data and they know so much about these athletes and they have such great staffs and the athletic training staffs are so talented. They know everything. So the thing that we see at the lower levels, even the D1 college level, is this enamorment with upper body strength. And what happens to these kids, the high school kids, the college kids, and even some of the lower level pro guys, is they get tight shoulders. And that's the number one injury risk for a thrower from a modifiable risk factor and that doesn't relate to throwing too hard or too long, just a physical factor. Tight shoulder is the worst possible thing for an elbow, and because the stress goes to the next stop on the train, which is the elbow. And so I would say that right now in my office, I asked one of the fellows this question today: what percentage of the people that I end up operating on for Tommy John surgery come in with a 30-degree or more motion loss in their dominant arm, which is a huge amount of motion loss? They should have, 180-degree arc of motion in their shoulder. And I'm seeing these guys come in with 30-degree motion loss. That's a giant number. And the number of people that I end up operating on with this is probably 90+% of them.
Wow.
And it's a huge thing. And I think all of us in the elbow world are now saying, this is something that has been seeing us for years that we haven't picked up on. And now we're picking up on it. The problem is, in order for us to get research out there and get it published and get it mainstream, will take 5 to 10 years. So we're all screaming this at the top of our lungs. We're screaming it to everybody. Major League Baseball doesn't necessarily have that problem because their athletic trainers know exactly how many degrees of motion these pitchers have, and they pick up on the smallest of deficiencies and they adjust. That's not really a problem at the pro, level. But at the college and high school level, these guys are lifting their faces off, they're growing, and they're throwing a lot. And those are the three things that'll tighten up a shoulder. So I would say that's the number one modifiable risk factor, is to not lift and throw at the same time. Don't lift heavy upper body in season, and maintain shoulder arc of motion, which is something the athletic training staffs of just about any school should be able to do.
Is this something you think? You say it's not a problem at the big league level, but I would imagine that those guys who are now at the big league level were lifting like that when they were in high school and in college and might have done some damage on the way up the ladder.
They may have, but the pro teams, even at the minor league level, they know not to do that. They know this is a known quantity at the major league level because it's the smaller number of people for us to get that information to. And they've had that information for probably 5 to 7 years. You haven't really seen major league teams going for heavy upper body lifting in the probably 5 to 10 year range, which is part of why we're not seeing all the shoulder injuries we used to see. We used to see a ton of labral injuries and rotator cuff injuries. We're not seeing that so much. The UCL injury rate has gone up, but it's been fairly consistent over the last 5 to 10 years. It hasn't really spiked that much. We had a little bit of a spike this year, which I think we can explain through a couple of things that have happened. But I think that from a shoulder maintenance program standpoint, the pros have a pretty good handle on that.
Tom House likes to call it Noah Syndergaard syndrome, the
Yeah.
the really big beefy guys that come in with a
Yeah.
loss option and then something just blows up.
Yeah. If you can't rotate your shoulder in, you're gonna have to not you can't get out in front of it. You can't get on top of it. You start to see more arm side run on your fastball, and you put a lot of stress on the medial side of the elbow. I mean, it's a preventable problem. But like I said, of the surgical cases that I do, probably 90% of them, which is the high school and college kids, have a loss of internal rotation.
I was going to ask you, what's the average age of the pitcher you see on your table?
I would say average, if you take all comers, most of us are going to say probably around 18. There's going to always be more high school kids than there are college kids than there are pro guys.
Just because there's
So
more.
it's just the pyramid, the pyramid is stacked to high school, and then much smaller number go on to college, much smaller number go on to pro. So there's just a pyramid of the population.
Aside from the number of Tommy Johns that you do, what are the other common surgeries that you see?
We see a fair amount of biceps, superior labrum pathology in throwers. We see a lot of posterior labral injuries in hitters. So the shoulder stuff is more common in the hitting population, the defense population from landing on it. You get some shoulder instability stuff. The hand and wrist guys see some hand and wrist things with hamate injuries and wrist injuries. The soft tissue injuries, the hamstring strains and things like that are always going to be the most common things we see. You're not going to see a whole lot of ACL injuries in baseball, but you're going to get a lot of hamstring strains, a lot of oblique strains, even some abdominal strains, shoulder tightness, forearm strains. The soft tissue stuff is always going to outweigh the big stuff, but the surgical stuff we see is more elbow than shoulder right now.
It's funny, when I was at MLB, I actually did stories on both oblique injuries and hamstring strains. And what a lot of the doctors thought was it was a byproduct of the weight room as well,
Oh,
where you're
definitely.
lifting so much, you're teaching your body to generate so much force from the ground up. And then when it gets to your poor little obliques, it just can't handle it and something explodes. And then the
Yeah.
hamstrings, guys sitting around and then they try to sprint down the first baseline after sitting on the bench for a
Yeah.
while and you just can't handle that stress.
Well, and I was talking to Jamie Nelson, who's one of the longtime Rays coaches, and he's a catching and hitters coach, but he works with the pitchers a lot too, being a catcher's coach. And from a hitting perspective, he says, look, these guys, especially at the pro level, at the MLB level, they're going 162 games a year. They may be not in the game, but they're up and down the dugout steps. They're out there. If they're playing, they're running out to their positions. They're exercising even when they're not going full blast. They're going before the game, they're going during the game. You get a guy who's on the bench who's not playing in the game, he may be doing some up and downs on the stairs or running out to warm up somebody or doing some sprinting on the side. There's more going on. They're not just sitting there. These guys don't do well just sitting. There's not a lot of sitting around for these guys, even when they're not on, they're still active.
Yeah. The oblique one was so interesting to me too, though, because it's like, hitting and throwing are such specific movements that you're not really training when you're doing a giant deadlift or a back squat or something.
Yeah, it's
It's a little
rotational.
more specific.
Yeah.
Yeah.
I
Um,
think at the major league level, you were asking about things that we see. I got a call from John D'Angelo and the Major League Baseball crew, and I think they reached out to a bunch of us in the elbow world after this kind of spike this season of what we saw, asking, what we thought was the likely cause. And there were some people suggesting it was the pitch clock. The pitch clock may have a little bit to do with it, but I think on the grand scheme of things, the pitch clock is a small potato. They have pitch clocks in minor leagues they've had for years, and there's no pitch clock in the bullpen. So, if you're going to really think pitch clock, I don't think even the pitchers would say the pitch clock. They don't have to like it, but I don't know that I would say that's increased the injury risk. I think a bigger issue is they took some of the tack off the ball. So
mm,
the surface of the ball changed and they eliminated their ability to, put stuff on there that gave them better grip. They lowered the seam. So basically you're talking about a pearl at this point. And pitchers don't like that. They need to be able to grip the ball. And so they're gripping the ball tighter. All of the pitchers that I've seen this season have said they feel like they have to grip the ball tighter. They have to squeeze more to develop the spin. And pitchers are starting to develop these pitches they call sweepers, which is kind of a new thing. We've been enamored with velocity for a long time, but I almost see more people talking about spin rate now than velocity. Everybody's got velocity, but now everybody's talking about spin rate. And these sweeping pitches or these sweepers they're learning are putting even more stress on their elbows. So I think the combination of what we did to change the tack on the ball, creating more grip power, which you're fatiguing the muscles, and some of these new pitches we're seeing are probably more responsible for what we've seen so far in Major League Baseball than the pitch clock. That said, the Major League Baseball had to level the playing field a little bit, which is part of the game. And to expect that there won't be a delta in injury, no matter which direction you go, if they moved the mound in and made the bats heavier, there's going to be more injuries in the hitters, and so there's going to be a give and a take. I think that as always, these things will level out, and the pitchers will get accustomed to it. But maybe we should have expected a little spike this year.
I cannot imagine them moving the mound in with guys throwing
No,
103 miles an hour.
no, I'm just saying there's going to be there's a yin for every yang. Every
Yeah.
little change is going to have a downside.
Um, you're talking about spin rate. Like there's also a lot of like, I would imagine that especially without the tack on the ball, that the guys are also trying to put a lot of spin on kind of late, which is also not great for your arm. And then, we can say the velocity may not be the main cause, but this chase for velocity with how hard guys are throwing, coupled with all of these other things, spin, it really can't be great for
Oh,
elbows.
it's a recipe for disaster. And especially at the lower levels. When you're looking at a 21, 22-year-old doing this at the college or pro level, their bodies are not fully mature. They're still growing in ways. They're still getting broader. Their shoulders are getting broader. They're still developing, and you're demanding a lot. That's a lot of stress on a body. We always tell the college guys, if you're going to recruit a 17-year-old, 6'4", 230-pound kid who throws 95, it's not a matter of if, it's a matter of when. The body is just, that's a lot to ask of an adolescent. You're asking a lot.
When you do surgeries on young kids like that, do you talk to them about how hard they throw?
We always ask what their max velocity is, what their typical velocity is. What I'm trying to get from that is every pitch a max effort pitch. If you look back at Steven Strasburg is a good example. When he was at San Diego State, it looked like he was coming out of his shoes every time he threw a ball, and he was throwing 101. As a major leaguer, Steven Strasburg rarely topped 100, and towards the end of his career, when he was very effective, he was in the mid 90s, and he learned to pitch. He was a better pitcher, and he had Tommy John surgery, but it's not that he couldn't throw that hard. I think he learned that, putting all that effort and putting a max effort on a pitch is not, I mean, all the pitching coaches would tell you that your fastball should be a 93 to 95% effort. It shouldn't be a come out of your shoes thing. And we see that. And I'm trying to figure, is that what this kid does?
Yeah, you got to figure too that if it is 110% every time, that fatigue is going to come in a lot more quickly. You're not going to be able to clear that lactic acid so quickly, and you're gonna have some more problems.
Well, and you're going to have mechanical breakdowns. You can't function efficiently and correctly. If you look at, Tiger Woods swinging a golf club at max speed, even he'll tell you, you don't do that because you can't control it. You have to do it in a way that you can control it. And that's the higher you get in effort, the harder it is to control it.
I always love the golf analogies, and I've said this on calls before, but Tommy John always said that after he had his Tommy John surgery, the original one, he really learned how to pitch. And when he was coaching in college, the way he got the point across to his players was to make them all play a round of golf with one club. So they had to really hard and spin it and
I love
poke
it.
down and chip, and it really is. Though you can't, if you're throwing 103 every pitch you throw, these are big league
Yeah.
hitters going to catch up to you. You got to
Oh
you
yeah.
got to
Yeah,
do
yeah.
something else, right?
No doubt. No doubt. He's such a gem, he's such a he's gotten involved in these things, and I've had a chance to meet him a couple of times. He's just a gem of a human being, and I think it's amazing that he gives his time to help with this, and it's important to him, which I think is awesome. So if you're watching this, Tommy, we appreciate you.
Today is actually Tommy's 81st birthday. I was texting
No
him
kidding. Oh
earlier
my gosh,
today.
I
Yeah.
need to reach out to him. That's
Yeah, he's
awesome.
he's he's great.
That's
Um,
awesome.
I want you to talk a little bit. You were I think I'm not sure if we met before this, but I did a story at MLB on Gordon Mackay's, the Scottish
Yeah,
surgeon, and you had
yeah,
the internal brace going and the ankle
yeah.
surgeries for the Scottish soccer players, football
Yeah.
players as they call them in Scotland. And you kind of took that surgery and adapted it for UCL repair. So could you just kind of explain that a little bit for the folks on the call?
So a lot of credit to Gordon. He's an amazing guy. As Lindsay said, he's a Scottish foot and ankle surgeon, and he took a construct. The internal brace is really a construct of a couple of small anchors, a couple of small little plastic screw-in anchors. They look like little corkscrews with a tape spread between the eyelets of the anchors. So you kind of take this tape, put it in the eyelet, drill a hole, push the first anchor into the hole and advance the anchor in there so it holds the tape in the hole. And then you put the tape across whatever ligament to another anchor and dunk it into another hole and advance it. And you've basically anchored this tape on both ends where the ligament originates and inserts. So it's a spanning construct anchored in bone. These pieces that make up the internal brace construct were not new. He was just the first to kind of put it together as a way to span a ligament and augment it. And I went to Arthrex and I said, I think we can do this in the elbow. And the first response I got was, no, that it's too small. It won't work. We gotta go bigger, which won't work in the elbow. And I said, no, I think we can do the same thing in the elbow, and I think it'll be fine. And no, it's too small. I said, well, let's try it in a cadaver. So I flew down to Naples and I did it in a cadaver, and I showed him we could do it. And then the engineer said, this is going to change everything. Everybody, this is going to replace Tommy John surgery. And I said, no, 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 no. This will take the place of some Tommy John surgery, which is really what it's intended to do. And what we've found over the last, 11, almost 11 years of doing this technique, number one is one of the most rewarding parts of this, aside from the patients I've been able to treat, is that my colleagues around the country, from Dave Alchek, Chris Ahmad, Jim Andrews, Neil Eltrosh, all these guys have come to recognize that this is a technique that works really well, and they've adapted it to their practices, whether they do it themselves or they send it to other people. Keith Meister, George Paletta. I mean, fill in the blank baseball docs that do these things. Everybody's doing them. And that's amazing because these guys are all very, very talented elbow docs. The other thing is that we really haven't changed from the beginning, that it's people who have good tissue that's torn off of one end or the other, or minimal kind of partial thickness tears. It's not for the ones that are blown up. It's not for the ones that have bad tissue or tissue deficiencies. They need more collagen. They need more tissue. They need full Tommy John surgery. And that hasn't changed. And I actually think that another criteria is it has to have a benefit of a shorter recovery. If there's no benefit to you of having a shorter recovery, Tommy John surgery, UCL reconstruction, is still the gold standard. And it's a great operation. And I don't think we ought to be doing other operations without considering that as the gold standard. Now we're into all these different hybrids and things like that. It's going to be a long time before all that gets sorted out because everybody kind of has a different version of the hybrid, so to speak. But internal brace is here to stay in terms of that. Dr. Andrews actually now tells people he thinks all Tommy John surgery will be done with internal brace in the not so distant future. I can't tell you that I agree with that, but I think that at least it's on people's minds. And for me, I'm just rewarded by the fact that it was an idea that came to fruition. So it's been very rewarding to see my colleagues adapt it.
It's very cool. I remember when I did the story, I think you described it as a like a tomato steak with the tomato plant growing up it, and the steak
Yeah,
would be the suture tape, like kind of just
yeah,
providing a little backup for the repair. And it was like a really good image in my head. Do you
yep.
think so obviously not every Tommy John, if it's that mid substance tear or the end avulsion, that you use different practices, but so many people, like I was just reading a story today about some pitcher who needed Tommy John, and they said they weren't sure if it was going to be the regular TJ or the internal brace. But I think the internal brace, because of the reduced rehab time, has made people less and less afraid of getting Tommy John surgery. Do you feel like this, Tom House talks about, knee surgeries back in the 80s, and people were really scared of them. And now a knee surgery is like nothing. And
Yeah.
do you feel like that's where Tommy John is going, where people have become less scared?
I think so. I think people are trying to pull the trigger. I see people in the office all the time, and they have injuries that, 5 to 10, even 10 years ago, we would have said, let's rest this for 90 days. It's probably going to be fine. Major league guys would do this is what a major leaguer would do. They would take a break and rest. And people are very reticent to rest. They're very reticent to give time for the body to heal because the time through some of these operations is less now, and they want to push the timeline. And I'm always wanting to remind people, and I do this in my office, there is no problem that surgery can't make worse. I'm a surgeon. It's what I do. But if you
Yeah.
can avoid me, you should avoid me like the plague. It is something you do when you have to. And yes, these are good operations with high success rates, but if you have a chance to avoid it, avoid it. And if you can stretch your shoulder out and your elbow quits hurting, why would you have an elbow operation? And that's probably the biggest population of people that I send away are people who come in with these very, very minimal findings on their MRIs, which that's another point that should be made is MRIs are not the window into the soul that everybody thinks they are. And there's some pretty crappy MRIs and there's some pretty crappy readings. And you can't treat the image. If you MRI'd every Major League Baseball player, none of their elbows look normal. And yet they make gazillions throwing balls and do great with it. You can't manage the image. You got to manage the person. And you got to be careful not to overtreat these things. So I send people away because their shoulders are tight and tell them to go stretch their shoulder out. Let's see how your elbow feels. Maybe you'll feel better if you just get your shoulder moving right.
Do you still have parents bringing kids in wanting prophylactic Tommy Johns?
Oh yeah, yeah. I mean, believe it or not, it happened last week. I had a kid come in, like 13, 14-year-old, and he came in with like 4 or 5 different MRIs.
My God.
And doctor seen 4 or 5 different doctors. And of course, when that happens, you see enough doctors, you're gonna get a different opinion. You're not gonna get everybody saying the same thing. And as soon as one person even suggests that there might be a small tear, oh my gosh, you changed the whole world. And the kid's shoulder was so tight, and he really wasn't even throwing. He'd already rested, and he hadn't thrown in like 3 months. And I said, "Do you even know if it hurts anymore?" And he said, "Well, I haven't thrown in 3 months, but I have a tear." And I was like, "Well, where does it hurt?" And he said, "Well, it doesn't hurt." I said, "Well, when does it bother you?" He said, "It doesn't bother me right now." I said, "You flew all the way here for, I mean, I feel bad that people do that." And I try to get people to send imaging ahead of time if they're going to do that. But this kid managed to get in there without doing that. So I sent him home. I said, you don't need an operation, man.
Good for you, though. What about like the Nolan Ryan strategy where he tore his and decided not to have surgery and wanted to let it scar down? Is that a viable option?
Well, and this is like when a kid comes in and says, well, Aroldis Chapman does, plyo balls. Okay, let's be clear about something. You are not today, nor will you ever be a Aroldis Chapman.
Mhm.
Okay, and that's just there's some genetics there that are just not the same. Nolan Ryan, I've never had the pleasure to meet him, but I've watched, the stories, and I've watched, the movies, and obviously the legend. That guy was an athlete among athletes, and he could do things that other people couldn't do. And the person I probably would liken the closest to him would probably be John Smoltz in the era of our time. These guys are such tremendous pitchers, and they don't have to be 100% to be effective. And they can somehow will their bodies to do things that other people just can't seem to manage. And Nolan Ryan was able to do that. So I think that there is a natural healing that takes place. I do. Can you wait some of these things out? You can. Can you overcome it with just mental toughness and deal with the pain? Plenty of people have done that. I think UCL injuries probably existed back when your grandpa played, and
Yeah.
there were plenty of people that through it and managed to be pretty damn good at the game.
They also kind of took the whole winter off. They had a little bit more
Yep.
time. They weren't throwing. They might have gone down to like Oklahoma and baled hay. They were doing something
Yep.
different to, so I think it was a little bit different, but
Well, and
yes,
they weren't throwing 100 either, but
yeah. Some of them were. Bob Feller was.
some of them were. Bob Feller was. That's right. Bob Feller was. That's right.
Um, if there were three things, I'm gonna jump into some of our Discord questions. If there were three things that you could change or ask coaches to consider to help prevent UCL or other arm injuries, what would it be? What would they be?
The number one thing I would say is to make sure that they check their ranges of motion on a daily basis. Don't let them throw if they don't have a range of motion that's normal. And learn how to measure it properly. Learn how to measure the total arc of motion of the glenohumeral joint. If you don't have an athletic trainer, or you don't have a physical therapist, you don't have somebody, it's easy to learn. There are videos. You can look up Kevin Wilk. You can look up any number of resources and learn how to measure it. And it's not hard to measure. It takes seconds to do it. And I would do that. And I would never let a kid pick up a ball if their shoulder didn't move right. The second thing I would tell them is get out of the weight room. Major league teams don't lift their pitchers heavy in season. Get out of the weight room in season. You should do some light maintenance stuff for upper body, different to lift heavy lower body. But as a thrower, as a pitcher, you got to leave off the upper body heavy stuff. And the last thing I would say is, especially in younger athletes, even though they may be on the same team, you may have a 17-year-old team or a high school team. There are 17-year-olds who are grown men, and there are 17-year-olds who are little boys, and everything in between. And even though they're on the same team, doesn't mean they can do the same things, nor should you expect them to do the same things. You have to get individualized a little bit lower in the age chain, even at the college level, a freshman versus a senior. The amount that they ask these guys to do, and the freshman is already going to try to overdo it and prove something. You're talking about a massive difference in body maturity between 18 and 23. And I think you got to really look at those things. When a major league team drafts an 18-year-old high school kid as a pitcher, they don't want that kid anywhere near a major league baseball game at age 18. They would never make it to the all-star break. They would be hurt before they got halfway through the season. And they know that. And so they're going to protect these people because they're assets. And we don't see that in college. It's the next man up philosophy, win now. That's the way baseball is. And it's not the coach's fault. That's the environment they're in. But those would be the three things I would change.
You work with ASMI too, and they're the ones who put out the pitch counts. How much do you think that helps?
I think the pitch counts are real at the youth ages, at the high school ages. I definitely think they are because you still have open growth plates. You're still dealing with developing bodies. And I do think that while there are probably 18-year-olds that can go 110 or 120 pitches, how many people at the highest level of baseball have thrown 110 or 120 pitches in a game so far through May 20, what's today, 22nd? I'll bet you there's not a single major league pitcher that's thrown 120 pitches yet in a major league game,
We had just
or
a
even
109
110.
the other day, right? The
109, right?
game. Yeah.
But that's the highest, and you're going to see that in high school all day, every day, at every level in every state. And I just think that that's you got to really control that stuff.
And as Tom always points out, that didn't include the warm up in the bullpen, the five
Doesn't
pitches
include,
before every inning.
yeah,
Yeah,
doesn't include any of that.
it's crazy.
Doesn't include what they're doing with their pitching coach. Doesn't include their bullpens. Doesn't include throwing from shortstop or whatever other position they play if they're a two-way guy. It doesn't include any of that stuff.
Paul Hartzell is in this call. He's through 700 innings in the big leagues. He says, I know I wanted to pitch out of my traditional windup from about 1976 to 1984 because I had better use of my entire body. How do you feel about today's style, no windup, which they're using Little League to the big leagues today?
I think that's something that has been. First of all, Paul, I appreciate the question. I think it's something that's understudied. I was a very, very low level pitcher through a lot of batting practice, but there was no question I could get better behind the ball and control it better with a full windup than from the stretch. I think people are modifying that to some extent. The slide step, just deliver the ball from a stretch position to slide step and throw, I think is probably the most dangerous. The guys that'll kind of start in a stretch position but take a step back and take a full leg kick and deliver the ball, that's probably not as dangerous. They're shortening their delivery, so they're creating more consistency by doing that rather than doing a big step back, step towards first, big leg kick, those kind of things. So I think they may be creating some consistency in their delivery, which is always good. But I agree with you. I think anything that does just the slide step delivery is probably dangerous.
Um, Tom House, this is from James Stewart. Tom has mentioned several times, and he talks about data with young kids throwing curveballs that properly thrown, there is not more stress on the arm. Do you share that belief?
I don't. I don't think there is any more stress on the UCL. We've done that data, but that gets misinterpreted. They're not saying there's not more stress on the arm. They're saying there's not more stress on the UCL.
Okay.
Well, it's the same motion from an elbow perspective. You're still delivering the ball. The difference is you're spinning your wrist. So the muscles that spin the wrist and spin the ball also attach to the same place that the UCL attaches. So the motion itself does not impart more stress on the UCL. But the added difference of spinning the baseball does put more stress on that same piece of bone in that same area. It fatigues the muscles that are there to protect the UCL. And so there is more stress on the arm by throwing a pitch that spins. There's no question that the arm motion is the same, and you wouldn't expect that that would place more stress on the UCL because the arm position hasn't really changed. But you are adding a dimension of spin, which requires a muscle movement from that same piece of bone. The tendon muscle unit that spins a baseball attaches adjacent to the UCL. They are right next to each other. And it does require more stress to do that. So, by definition, you are putting more stress on the elbow. You're just not necessarily putting more stress directly on the UCL from the throwing motion. And
Tom
we,
talks a lot about like presets, like setting the hand in the glove so you're not snapping.
yeah, and I think that that's fine. Throwing that pitch where you're really just kind of coming more over the top rather than snapping your wrist, I think that that's perfectly okay. We kind of tell people don't throw breaking pitches until you shave. You know, I once heard somebody, Tom would probably say this too. There's no such thing as a good high school pitcher.
Yeah.
There's high school throwers, and learning to pitch. I've had college coaches tell me, if you could give me a kid that can consistently throw an 85-mile-an-hour fastball and a changeup wherever I tell them to, I could win ball games left and right with two pitches if they could just put it where I tell them. And, so I think that control, we don't really talk about control, but that's what pitching is. That's the Maddox, that's the people that have Smoltz, the guys that have really been incredible pitchers over the last couple of decades. Yeah, some of them threw hard. Randy Johnson threw hard. Max Scherzer throws hard. All these guys throw hard, but their control is pinpoint, and we've kind of lost that. And there have been some amazing pitchers that don't overthrow,
Mhm.
that just pinpoint two or three pitches extremely well, and that is what separates them. We've kind of lost talking about that.
I think that's just because of this whole chase for
I
velocity
agree with you.
gets lost in the shuffle. We had Gene Watson, he's the director of player personnel for the White Sox on, and he was like, I hope it comes back because,
Oh God, yeah.
I won't recruit. He said he won't sign someone who's just throwing 95 miles an hour because it's an accident waiting to happen. You got to learn
Yep.
how to put things in different places if you expect to have any kind of longevity at this point.
Yep.
Um, a lot of guys say that their arms come back feeling better than ever and so much stronger after they've had the Tommy John surgery. And I kind of think it's a little bit scary to credit it all to the Tommy John surgery. How much of that is to do with this rigorous rehab program that they go through when they're trying to come back?
I think a lot of it is the rigorous rehab, and we're correcting flaws. We are stretching their shoulders out. We are making sure their bodies move well. We're making sure they're balanced. We're making sure their cores are working correctly, that their forearms are strong, that their flexibility is good, all those things. There are some who I can remember when we first started, we had a couple of guys from the Blue Jays, this back in the early 2000s that we Andrews did, and they came back throwing 8 miles an hour faster, 10 miles an hour faster, and these people showed up with their bags packed wanting their kids to have prophylactic Tommy John surgery to get 8 or 10 miles an hour more. And it was like, your kid hasn't even passed geometry yet, we got to go home. That's not going to happen. But the difference is that some of these people don't have good elbows to start with. So we get some of these guys, and their elbows have not been good for a long time. They've had beat up elbows. They've got chronic changes. They've got bone in their ligaments. They've got the ones that are beat up, and you fix them, and it's like a breath of fresh air. They don't hurt anymore. And they'll all say the same thing. These guys come back and they say, I never knew how much my elbow hurt until I got it fixed. And they realize, like, this is what it should feel like, and they were dealing with that before. That's the kind of person that may come back and throw harder. But as a general rule, we don't tell people to expect to throw any harder or softer than what they threw before, because velocity doesn't come from the elbow. You can lose it there, but you can't get it there. And so when people call me after surgery and say, I'm not quite back to my normal velocity, I tell them to find a full length mirror and figure it out.
Yeah.
It's not coming from their elbow. That's not where velocity comes from.
When you're doing like so we talk about getting guys out of the weight room, but like this Tommy John rehab is basically prehab as well. It's an arm care routine. It could be a warm up, could be a cool down. If kids paid more attention to that kind of exercise as opposed to the weight room, do you think we could cut down on some of this?
100%. And I think there's some brilliant people. Eric Cressy, brilliant. The guys at Texas Baseball Ranch, Ron and those guys are brilliant. These guys are just seriously good performance trainers. Eric Cressy's just got to be one of the best ever. And they're not the kind of people that just push, maxing out in the weight room. That's not where velocity comes from. I go through this exercise with kids. So I'll have a kid come in and they'll talk to me. I had a kid today. He looks like a linebacker. He looks like Adonis and looks like he's playing the wrong sport, to be honest. But he's a pitcher and he's got a Tommy John injury. So I said, okay, how tall are you? How much do you weigh? So he says, I'm 6'1", 190 pounds. I said, okay, let's take every 6'1", 190 pound 20-year-old that pitches and line them up in a line just take how many of them are there going to be? 2,000 of them? Let's take all 2,000 of those kids and line them up and tell them to all grab a ball. And everybody, I want you to throw this target over here, but I don't want you to move your body. I just want you to throw it with your arm. Don't bend, don't twist, don't use your lower half, just arm. That's all you get, is from shoulder to wrist. That's all you get. How much difference in velocity are you going to see between all 2,000 of those kids that are the same age, same height, same weight, and all they can do is throw with their arm? And they all say, well, there's not going to be that much difference. I said, exactly. So where does velocity come from? If it doesn't come from that, where does it come from? If all that upper body lifting, if you're not going to get it there, where are you going to get it? And it's the dichotomy of a body to throw a ball well. You got to be big and strong from the ground through your shoulder, through your torso, and then you got to be long and loose to deliver the ball.
Are there Colby asks, are there exercises that you recommend to improve elbow UCL strength to help decrease the risk of injury?
The number one thing I would say is to do the sleeper stretch for your shoulder to make sure your posterior shoulder capsule is not tight. Because as soon as that gets tight, that's the death of an elbow. So I would learn how to do the sleeper stretch properly. That's something you can do on your own. I would make sure that your flexor mass is flexible and strong and not fatigued. So, that's a grip thing. We used to, in the old days, we did the rice bucket, stuff like that to build forearm strength. You obviously have to do that and give it plenty of chance to stretch out and rest before you throw. I wouldn't be doing a rice bucket, minutes or hours before you're going to throw hard. But getting that forearm strength, that flexor mass strength and flexibility to protect your ligament is certainly important. But the number one thing is to get your shoulder to function right.
I have a pinky ball on my desk signed by my
Hmm.
yogi because
There you
he's
go.
used pinky
Yeah,
balls his entire
exactly.
life.
Exactly. Exactly. I like the pinky ball.
Yeah, he was a big fan of that. There was the high, it was what they used to play stickball in the street when he was
That's right. That's right. I remember
young, and I don't know, I found this in the kitchen, and I kept it. So yeah.
that.
But, let's see, let's go through here. Um, there is a non-zero risk for injury in any sport, and that risk in baseball increases for pitchers as harder throws produce more stress. However, it seems as though discourse is narrowed to the point that velocity has become a boogeyman of sorts. I guess how much do you think of velocity as a boogeyman? We talked about some of the other primary risk factors for elbow injuries, but we've talked a little bit about velocity, but just why is it so dangerous if your mechanics are not pristine?
So if you look at just look at we'll talk about Chapman, for instance. Does Chapman look like he's max effort throwing? I mean, it's so smooth and silky, and he's halfway to home plate when he releases the ball. Like Randy Johnson. Randy Johnson was just silky smooth, and bang, it's 98 right on top of you. And some of these guys, their delivery is so seamless and smooth, and they're not just reaching back, coming out of their shoes on every pitch. And it comes out easy, and their bodies can just do that. Some of them, it is absolute max effort to
Mhm.
get that, and because we're chasing velocity. And that to me is the difference. The people who can do it and it's mechanically sound and their bodies can rotate in a way that is efficient and use their musculature and their flexibility together to deliver the ball with velocity, that person's probably not going to get hurt as often as the one who has to max effort it. It's going to get inconsistent. The harder you do it and the closer you get to max effort, the more you're going to suffer mechanically. So, it's sometimes you just got to recognize that you may not be able to go max effort.
We had Walker Bueller in recently on route to his comeback, and he was
Mm-hmm.
actually talking about how important it was to nail down his mechanics in his rehab before he
Mm-hmm.
came back, because when you get into a game and the adrenaline is pumping, it's kind of hard to control that effort. Like you're out
Yep.
there and you're gonna dig deep, so you need to nail the mechanics and get yourself comfortable before you head out there, so you don't do as much damage.
I agree completely. And if you're a 95% guy, or there's still a little bit in the tank, and you can maybe get some 93. I remember, I don't know if it was I forget who said this. I'm sure Tom would agree. The deadliest pitch in baseball is a changeup. I mean, I forget which pitching coach of note said that, but changing speeds, if you can change speeds effectively, even among your fastballs. I remember when John Smoltz came back from his surgery, before he went out, he was throwing 89, 90, and he was normally a 96, 97 guy. But he was such a good pitcher, he would change speeds and get these guys back. When he came back, he was 92, 93 when he first came back, and he had to get out there and go get people out. But he was a good enough pitcher that he knew that if his changeup was 85 rather than 88, he was going to have that 8 to 9 mile an hour difference, and that was going to be a big enough difference to get hitters to do it. Rich Hill last year, I mean, Rich couldn't throw above 91, but the spin rate on his curveball was probably the highest in the majors, and he could spot that thing anywhere. And then he throws a 88, 89 mile an hour fastball at you, and it looks like it's going 100.
Yep.
And so that change of speeds is still pitching, and I agree with coach who said he's looking for that to come back, because that's real.
Tom talks a lot about real, perceived, and effective velocity. Real being what's
Yep,
on the gun, perceived being what it looks like, and effective is what it is compared to the pitch before. And if you
definitely.
can keep those spreads, I think he says 12-mile-an-hour difference is a
Yep,
lockout pitch. But
yep,
from a perception standpoint, if one is up and in and the next one is low and away, it
yep,
it makes that gap even bigger. So if you can
yep.
work corners and change speeds, you're kind of golden without putting as much stress on your arm.
Yeah, and that was something John said. He said his control. He talks about when he was a kid, he would throw in between his house and the house next to him, and he would just throw tennis balls at this backstop. And he was a hockey player and about him, he played three sports, but he would spend his summers throwing at these little squares on a little thing that would bounce back to him. So he built his control that way. And being able to throw pitches where you want to is still what pitching's about. And that's definitely more interesting as we go forward with all these injuries and having people come back and back away from that max effort throw and learn to pitch a little better.
There's a question, it was about pitch counts being a form of risk mitigation at the younger levels, but with pro pitchers, the question is it possible that overly conservative constraints keep them from building up to chronic workloads and thus being exposed to even greater injury risk when they reach or exceed their previous limits?
Yeah, and I think that there's teams that right now have gone to starting pitchers being 2 innings, 3 innings, and then it's a inning at a time to keep guys fresh and not go through the injury risk and all that. That's one way to look at it. That's a philosophy thing, and it's an interesting thing, and I think there's certainly times where that may make sense. But I agree that longitudinally stressing a body over the course of a season to get to a point where when the time comes, if there's a value to the team for them to say, hey, we need you to go 10 more pitches, it's not like that hasn't happened before, but it didn't happen all season. So I do think that that is a cautious but intentional stressing of the body over the course of time in people who are mature. I would not think you'd want to stress that in somebody who's young and immature because their body control isn't good enough for the extra workload. But in the mature body at the pro level or the high level college level, yeah, stressing the body over time and adding that extra workload to get to that point so that when the time does come in a tight game in the postseason when there's a lot on the line and every pitch is a high stress pitch, that person can function. It's like the guy who said you got to have your mechanics right and tune that before you go out there. You're going to overdo it. Same idea. I think adding some number, some level of increased stress over the course of a season to get them there. And I think that's really the tricky part in the art of it is how much do you add? When do you add it? And who do you add it to? Who can you add it to? Can you take a short reliever, a closer, and get 2 innings out of them when they really only do 1 inning all year? Yeah, I mean, can you test that in the last month of the regular season once or twice, and then as you go into the postseason, know that if you got to do it, you got to do it, and you got 2 innings in them. Yeah, I don't know that. I mean, I don't know that I would translate that to three, but I think it's about the pitches, and when you get to the postseason of any level, every inning's a high risk inning, and every pitch is a high risk pitch. So,
Tom
yeah, to,
talks a lot about guys, maybe those guys who throw really hard just as a function of having those, high energy fastballs. They don't spend enough time in the minor leagues getting prepared to pitch high impact innings. And then they come up and, like you said, they don't make it to the All-Star break.
yeah, and obviously when you're up there, when you make it to the show, ever you get started, everything is stressful, and you're just trying to prove it. And I get that. I don't know that there's any way to undo that. Maybe a late season call up is a little easier than an early season call up because it's kind of a reward. You're giving the regular guys a break when you add people to the roster and expand. They understand their role, and it's not maybe the only time they're going to get a chance. They're thought enough of that this is at least going to get them a major league invite next year, even if they don't do great, to camp. So that's probably a little less stressful than an early season, rookie or somebody new to major league where they've never been there.
I like this question because it's fishing for story ideas for me. What technology is ASMI working on to evaluate and understand elbow and shoulder injuries better?
We are looking at a study. We've got a couple of things going on in the thrower. Right now, we're looking at a study of all the people who come in to see us. We are measuring their shoulder ranges of motion, goniometer checked, and we're writing all that down and comparing it. We're trying to get healthy people to do it. So we're looking at teams at the high school and college levels in Alabama and Mississippi, and we're looking at people before they start throwing when they start throwing, during the season, after the season, and we're trying to measure injury risk as they have problems through the season, see who gets hurt. The only downside to a study like that, we're going to get really good data, but it's going to take a long time. It's like I was saying, it's going to take a while. We've looked at mound height, we've looked at different pitches, we've looked at hitting, we've looked at all these different things. I think there's probably some balance to be had that we need to look at, and we may be able to do it with the motion, with the markerless sense, the markerless camera systems. There's going to be some metrics on some body movements that we haven't thought of. We've got all these things that we look at, like this angle or that angle or trunk rotation and all these things. We may be applying a square peg to a round hole at times. And some of the people that come into these things, they may not fit specifically into those buckets, and we may need to create some more movement parameters. But those are probably the major things that we're doing.
I saw a couple interesting studies on grip strength being a precursor to
Grip
like
strength's a good one. Yeah.
they measured somebody's grip strength as a baseline, and then when they show up to practice, if you're not hitting your baseline, you don't get to pitch, much like you said,
Yep.
elbow range of motion. I thought that was kind of cool.
Yeah, I think that stuff's good too. There is some data on that. I think grip strength is super important. In recovery, people don't recover at the same pace, and people's recovery process can be different. Some people, I remember the days where after you pitched, you iced your shoulder. We don't see that anymore. We don't ice anymore. We want to do a little light exercise and flush lactic acid out of our muscles so we recover quicker. The recovery period, and these are things that the performance guys have really shown us, is how your diet makes a difference, how you hydrate makes a difference, how you rest. When you get to Major League Baseball, you're talking about these guys getting on planes right away and sleeping in hotels, and how different is it on the road versus at home? What's the stress level? How well do they rest? How well do they eat? How much time are they on a bus? There's all these different things that play into that level that we don't deal with at the high school level. And so I think there's a number of things we could look at. The travel, even in college, some of the travel requirements for some of these weekend trips is just crazy. Lots of time on a bus, sleeping in bad hotels, what food do you eat and who's controlling that? What's your test schedule the next week? How much stress do you have on you? There's some things that we could certainly look at.
So I drove by a ball field yesterday and saw a kid with a big ice pack on his arm. We say, "My name is Lindsay Berra, and I am a staunch anti-icer." And can you just give a quick rundown about why ice is not the number one thing to do after you throw? I want people to understand this.
Yeah. So what does ice do? We put people on ice. I operate on people, all the time, and we tell them to ice their joints. The purpose of ice is to vasoconstrict. That's what ice does. It constricts blood vessels. So when you're dealing with an acute injury like surgery, you're trying to slow down bleeding, which is definitely something that's in the patient's best interest in terms of swelling and pain. When you're dealing with exercise, you're not dealing with bleeding, and you're trying to flush lactic acid out of muscles. You want to get that stuff out of there. So when you're done exercising, the last thing you want to do is ice, because that's going to keep lactic acid in your muscles rather than let you flush it. So if anything, you want to do the opposite. And that doesn't mean I think you should jump in the hot tub after you exercise, but most people are too hot to do that anyway. But after a short cool down, after a rest period, go for a light jog, get on a bike for a few minutes, get your heart rate up a little bit. No max effort stuff. I don't think it's a good idea to do heavy exercise, heavy max cardio, high energy cardio. That's not a good idea. You're trying to get rid of lactic acid, not build it. And so the best way to do that is just some light exercise after performance.
I try to explain this to people all the time, that the way you move the gunk out is with your lymphatic system, and it's
Yep.
passive. So you got to move the muscles around
Got
the
to
vessel to
move the
get stuff
muscles.
out.
Yeah.
Work.
Move the muscles. Move the muscles.
I love this question. What's a good general rule to help determine if discomfort is injury or just soreness and fatigue, if there is one? And like, how do you know when to shut down throwing for a day, a week, when you should work through it and when you shouldn't?
So those are great. That's a great big question. I think it should never hurt to throw. If it hurts to throw, you throw and you feel pain. Okay, make sure you're stretch your arm, get the ball, throw another one. If the pain goes away, great. It was a one-off. You did something, you pulled something, you moved in a way that your body didn't like. But if the pain persists, that's not something you just say, okay, I'm going to keep pushing this. You throw a ball a couple of times and you feel it and it's not going away. I wouldn't push that. I would shut it down at that point. Rest, do whatever your normal post throwing regimen is. If you're a position guy and you want to hit, or gal and you want to hit, go hit as long as it doesn't hurt to hit. But I think if it hurts to throw more than a couple of throws, I wouldn't do that. And especially if it's accelerating in intensity, if the pain's getting worse, don't push it. I think I would then take at least a 24-hour break, maybe a 48-hour break, and I would probably seek the attention of a teammate, a coach, a trainer, or therapist, or somebody to check, is there something that's not moving correctly? And that could be anywhere from your trunk, your hip, your back. Are you not rotating right? See if you can get some video, if you have access to it, of your throws. Was there something different? Did you not stride far enough? Was your path short? Did you open your shoulder too much? Is there something mechanical that you could point to? If you don't have access to that, the next time you throw, get somebody to video it so you know what it looks like, if it didn't hurt or if it did. And then I would say if it hurts still, I would take a week off. I wouldn't just throw through it. Give it a week, 10 days, take some anti-inflammatories, try again. If 10 days or so, 2 weeks, and you're still feeling it every time you throw, that's when I would seek medical attention. There's nothing that you're going to have in 2 weeks that would change anything in the short term. And there's nothing we're going to do that's going to take less than 90 days, either through rest and rehab or, unless it's just a little muscle strain. Rest and rehab for a muscle strain in a pitcher at the high school, college, pro level is going to be weeks to months, not days. And so if you go past about the 2 week point and it's still bothering you, that's a problem that needs to be checked out. And
I
so,
think young kids, it's hard for them to tell the difference between what's pain and what's
yeah,
soreness.
what's soreness? You know, I don't think that I would tell a kid, especially with open growth plates, that it is ever okay to hurt when you throw.
Yeah.
It's okay to hurt a little bit after you throw, and maybe the next day you say, "Yeah, I'm a little tight. My arm hurts a little bit." Yeah, don't go throw. That's the worst thing you could do. But I don't think in a young adolescent, in a young open growth plate scenario, I would ever tell somebody it's okay for it to hurt when you throw.
When do growth plates close?
It's different, but basically when you shave, it's your growth plates are pretty much closed.
What about for
In
girls?
girls, they close a little bit earlier. So, it's not so much of a chronologic age, it's a physiologic age. And you'll see, 14, 15-year olds with full beard, and you'll see 14 and 15-year olds without a hair on them. So it's variable.